Greetings from the Tampa Bay Hearing and Balance Center. Dr. Allen, Dr. Danner, and I are delighted to be of service to you. I came back to Tampa in 1980 after residency training in Pennsylvania and fellowship training with the House Ear Institute in Los Angeles. Ears have fascinated me since I first became acquainted with their great three-dimensional depth. That three-dimensional depth has been a great means of fascination for surgery and for learning about the physiology and the abnormalities that come out of the ear. The bulk of our work is related to the complications of ear infection or taking care of patients with dizziness or balance problems. But an area of major interest is that of people who are hearing impaired, whether we can improve them with regular surgery or the cochlear implants. Thinking of a little girl who came to see me when she was 6.5 months of age. She had gone deaf from meningitis at about 5.5 to 6 months of age. Her parents were distraught. What to do? They were going to have a complete change of life. We were able to put cochlear implants in that little girl. And about age 4, she came running down the hall here in the office and she jumped into my arms. As she did so, she hollered, "I lost my flip-flop." I about cried because I realized here's this little girl who's deaf and she's speaking as clearly as a normal child. I was overwhelmed. And she's now 10 or 11 years of age. Her dad said recently that she came home and said, "Dad, I had to do it again." Well, what did you have to do again? I had to prove I'm deaf. I had to take my cochlear implants off. I'm just amazed and thrilled that we're able to help this little girl who would not have learned to speak clearly, who would have had trouble learning to read, and she now speaks normally. She's fully integrated in all the school system. We're able to take older adults and reintegrate them with their families because with cochlear implants they can hear again. We count it a privilege to be able to provide ear-related care, and this is an example of what we think is such a privilege.